Today we're going to be talking about the musculoskeletal system and back injuries in particular. How do you feel when you get a back-related claim? These claims are often very subjective in nature, and we need to have a good understanding of the anatomy of the spine and the claimant's functional ability so we can assess the claim effectively. We need to have all the knowledge so that we can bridge the gap between claimants that have real pathology causing significant issues and those that feel entitled to compensation. I'm going to start off with the anatomy of the spine. There are 33 individual vertebral bones that interlock with each other to form the spinal column. They are divided into different regions, which are the cervical spine, the thoracic spine, the lumbar spine, the sacrum, and the coccyx. Only the 24 top bones are movable, as the vertebrae of the sacrum and the coccyx are fused together. Starting off with the neck, the cervical spine, the main function of the cervical spine is to support the weight of the head. And there are 7 cervical vertebrae, and we number these C1 through to C7. The neck has the greatest range of motion because of the first 2 vertebrae that connect to the skull, C1 and C2. The first vertebra is ring-shaped, and it's called the atlas, and it connects directly to the skull. And this allows us to have the nodding yes movement of the head. The second cervical vertebra is the peg-shaped axis, which has a projection called the odontoid that the atlas pivots around. The joint allows for the side-to-side movement or the no movement of the head. The thoracic spine, or the mid-back, doesn't have much movement. And this is because it holds the rib cage together, and the purpose of the rib cage is to protect the heart and lungs. There are 12 thoracic vertebrae, and we label these T1 to T12. The lumbar vertebrae absorb the stress of lifting and carrying heavy objects. The sacrum is in the lower part of the vertebra. The main function is to connect the spine to the hip bones. There are 5 sacral vertebrae, which are all fused together, and together with the iliac bones, they form the pelvic girdle. And lastly, the coccyx region has 4 vertebrae that are fused together, and this is commonly known as the tailbone. The purpose of the coccyx is for the attachment of ligaments and muscles of the pelvic floor. In general, that's the anatomy. It's obviously a lot more detailed, but for simplicity, as long as we understand the anatomy, we can understand the functional ability in relation to each individual. So obviously, as discussed, the musculoskeletal system includes the bones of the skeleton, as well as the cartilage, ligaments, and the connective tissue that stabilize to connect the bones. And besides supporting the weight of the body, bones also work together with muscles to maintain our body position and to create controlled and precise movements. Without the skeleton to pull against, contracting muscle fibers would not enable us to sit, stand, walk, run, or perform any of our normal day-to-day activities. So, in order to classify back injuries, we look at a number of factors. However, the main classifications that are looked at and that we would see at claim stage are degenerative back conditions, inflammatory back conditions, traumatic back conditions. Some may be hereditary. Some are congenital, which means the person was born with a condition. Some may be neoplastic or related to cancer, and some may be infectious. I want to move on to talking about impairment versus disability. These concepts are very important for us to understand, especially in claims, because the benefits in most insurance companies are structured around these different definitions, and I think it's easy to get quite confused between them. So the first definition is impairment. Impairment is the loss of use or derangement of any body part, organ system, or organ function, and this is due to disease. And this condition or an impairment should be assessed via medical means. Whereas disability is a non-medical assessment, and it's the alteration in a person's capacity to meet personal, social, or occupational demands because of the impairment. So, in other words, they cannot work as a result of the impairment. We need to also differentiate between acute versus chronic back pain. Acute back pain is not something we would generally see, and most people at some point in their lives would have some sort of back pain. Those acute back pain symptoms should resolve in less than a period of 3 months, and they're often caused by sudden injury, whereas chronic back pain tends to last longer than a period of 3 months. From a claims perspective, we often see these claims much later on. We also have to understand the various medical terminologies relating to claims. I'm only going to touch on a few now, as I'm going to talk about some of the others a little bit later on. The first important one to consider, as most benefit definitions include this as a criteria or one of the criteria for payment, is radiculopathy. So radiculopathy is basically any pathological condition of a spinal nerve root. And this would typically cause pain, numbness, or weakness in the part of the body which is supplied by that particular nerve root. CAUDA equina syndrome, this is also less commonly seen. However, this is caused by compression of the spinal nerve roots, and the individual would have dull pain and loss of feeling in the buttocks, genital areas, or thighs, and have impaired bladder and bowel dysfunction, and would need to be treated immediately. Spinal stenosis is simply the narrowing of the spinal canal, and you'd see that terminology a lot, not only in the radiological evidence, but in the medical reports that we get from the specialists. And spinal decompression is a surgical procedure to relieve the spinal nerve compression that has resulted. Laminotomy, spinal decompression surgery where a small part of the lamina is removed. The lamina is part of the vertebra. Discectomy is surgical removal of the whole or part of the intervertebral disc. And that's where obviously as a result of a herniated or a bulging disc. Microdiscectomy is minimally invasive surgery where they make smaller incisions and the surgeon uses a special microscope to view the disc and nerves and remove portions of the herniated vertebral disc. And this is important to remember as benefit definitions cover certain surgeries, but with medical advancements, they're able to do less invasive surgeries, and usually people would choose the less invasive method if they were to be operated on. I want to move on to talk about neurogenic versus mechanical backache, as we commonly see these at claim stage. And I'm going to start with neurogenic backache, which is basically backache that is caused and controlled by the nervous system. Usually people would describe a severe, sharp, electrical shock-like pain, and it's generally deep, burning, or cold. They may have persistent numbness, tingling, or weakness, as the pain is generally traveling along the nerve path, and it usually goes into the extremities, the arms, the hands, the legs, and the feet. It's important to look out for these keywords when you're looking at medical reports, because this would describe the type of pain that we're dealing with and would also give us an indication of the recovery time and the period expected for the person to return to work or go back to normal daily activities. So for diagnostic criteria, we would need the medical history from the doctor, the physical examination that was done by the doctor, any radiological studies, usually a CT scan or an MRI scan, and then sometimes EMG, electromyography is done. So we would like all the supporting medical evidence to ensure that we understand how the diagnosis was made. The prognosis depends on many factors, and it also depends on comorbidities that the individual has and also the treatment options available to the individual. So we can't look at each case in the same way. Everyone is unique and different, and we need to look at their circumstances and keep this in mind when assessing a claim. So generally, depending on the condition, we always start with the most conservative option. If you went to the doctor for a back problem, they would generally recommend RICE, which is rest, ice, compression, and elevation. With the back, you can't really elevate, so you might be able to modify your activity. Rather than just maybe being completely passive and sitting around, you could move within your limits of pain and obviously recover within the shortest possible time. If you are maintaining your ability to work, you might need ergonomic intervention in terms of your desk setup. You could have physical therapy. You might be able to see an occupational therapist, a physiotherapist, a biokineticist, and medication may also assist. If the conservative treatment fails, you could move on to an epidural corticosteroid injection. It's still considered a conservative treatment, although more invasive than having some sort of physical therapy. And then finally, the last option is a surgical consideration. So the medical specialists and the paramedicals involved in the management of the condition are very important We need to be cognizant of who we get reports from so that we can make the most informed decision in the assessment of claims. We could look at reports from orthopedic specialists, from neurologists or neurosurgeons, from pain management specialists, possibly rheumatologists depending on the condition, psychiatrists or clinical psychologists, and as mentioned, physiotherapists, biokineticists, occupational therapists, or even chiropractors in terms of the rehabilitation of the condition.